Hello! In this video, we will review 3 Pocket Prep EMT practice questions, answers, and explanations. Follow the prompts along the way to study at your own pace. After each question, there will be a 5-second pause. During this short break, you should pause, answer the question independently, and resume the video. Let's get started.
Question 1. The return of spontaneous circulation has been achieved for a patient who was previously pulseless and apneic. They are now semi-conscious with adequate respirations at a rate of 22 breaths per minute. Which of the following is the most appropriate next step? The correct answer is option C. Give high-flow oxygen via a non-rebreather mask. Let's go over the incorrect choices first. Delivering another shock is not appropriate in this context because the patient has already achieved ROSC and is showing stable vital signs, namely semi-consciousness and adequate respirations. Defibrillation is used to correct life-threatening cardiac arrhythmias, such as ventricular fibrillation or pulseless ventricular tachycardia, not as a preventative measure post-ROSC in a stabilizing patient. While supplemental oxygen is part of the post-ROSC care, providing artificial ventilation, for example, with a bagged valve mask, is not indicated for a semi-conscious patient with adequate respirations. Artificial ventilation is reserved for patients who are not breathing or not breathing adequately on their own. In this scenario, the patient's respiratory rate of 22 breaths per minute suggests they are breathing sufficiently. CPR is indicated for patients in cardiac arrest. Since the patient has achieved ROSC and is showing signs of spontaneous circulation and adequate respirations, CPR is not appropriate. Resuming CPR in this situation could potentially harm a patient who is showing signs of recovery. After achieving ROSC, the priority is to support and optimize the patient's breathing and circulation while preventing hypoxia. Even though the patient is breathing on their own, their body has just been through significant stress, and their organs, including the brain, need high levels of oxygen to recover and prevent further damage. A non-rebreather mask can deliver high oxygen concentrations up to 100%, which is crucial in this phase of care. This intervention aims to ensure the patient's tissues receive sufficient oxygen to support metabolic needs and recovery without the need for invasive ventilation, given the patient's adequate spontaneous respirations. Question 2. A 73-year-old male is pulseless and apneic. Witnesses say he collapsed 10 minutes ago. Uninterrupted, high-quality bystander CPR was initiated 5 minutes ago. Which of the following is the most appropriate next step? The correct answer is option B. Attach an AED and proceed with rhythm analysis and defibrillation. Let's go over the incorrect choices first. While ensuring an open airway is a critical step in many emergency care scenarios, especially in cases of respiratory distress or unconsciousness, it's not the priority when dealing with a patient who might be in cardiac arrest. The immediate concern in such scenarios is to restore a normal heart rhythm. Opening the airway is important, but it should not delay the use of an AED, which can be a life-saving measure. The AED should be attached and ready to analyze the patient's cardiac rhythm as quickly as possible to determine if a shock is needed. Similar to opening the airway, providing rescue breaths is another critical intervention in specific scenarios, particularly in respiratory arrest or when the patient is not breathing adequately. However, in the context of sudden cardiac arrest, the primary focus should be on rapid AED deployment and chest compressions if CPR is needed, rather than rescue breathing alone. Immediate analysis and defibrillation take precedence over rescue breaths. Early defibrillation, ideally within the first few minutes after cardiac arrest, significantly increases the chances of survival. Effective pre-hospital care, including the use of an AED, is crucial. In cases of suspected cardiac arrest, the heart is either not beating at all or not effectively pumping blood to the body and brain. Early defibrillation is the most effective treatment for ventricular fibrillation and pulseless ventricular tachycardia, which are common rhythms in cardiac arrest. Question 3. In which of the following situations would nitroglycerin administration be contraindicated? Select the 3 answer options which are correct. The correct answers are options A, C, and D. Let's go over the 3 correct choices first. These are the situations in which nitroglycerin administration would be contraindicated. Erectile dysfunction medications cause vasodilation, similar to nitroglycerin. The combination can lead to dangerously low blood pressure, putting the patient at risk of a life-threatening situation. Always ask patients if they've used any of these medications before administering nitroglycerin. A high pulse rate suggests a compensatory mechanism for an underlying condition, such as shock or dehydration. Administering nitroglycerin could exacerbate hypotension, especially in a tachycardic patient, leading to further instability. However, the critical factor to consider here is the clinical context, including other symptoms and vital signs. In isolation, a high pulse rate requires careful assessment and might not independently contraindicate nitroglycerin, but in exam scenarios, considering safety first is a priority. Nitroglycerin is a potent vasodilator, leading to decreased preload and afterload, which can further lower blood pressure. Administering it to a patient with a systolic blood pressure already below 90 mmHg can lead to critical hypotension, endangering the patient's life by compromising coronary and cerebral perfusion. Shortness of breath can also accompany cardiac issues, making nitroglycerin beneficial in cases where chest pain is cardiac in origin. Therefore, this isn't a contraindication, but rather, it's a potential indication for nitroglycerin.
Click the link in the video's description to download EMS Pocket Prep and study any of our 7 EMS exam offerings. Pocket Prep is a mobile, quiz-based study platform designed to provide effective, engaging, and affordable study material for a wide range of certification and licensure exams. Download the app and get started studying for free today.